Okay, so continuing on with our personal care lecture, we're going to talk about bathing. Bathing is an awesome opportunity for you to observe the skin for any potential breakdowns. It also can help increase circulation through the movements of cleaning the skin and how you apply pressure as you're cleaning them. So we do wear gloves when we're bathing a resident because there's the potential that we might come into contact with blood or body fluids. We want to change our gloves before we clean the perineal area, which is their private part area, okay? Make sure that you remove all soap residue. Oftentimes I'll see students that will give baths, or when they're practicing baths, they'll do the step of where they're washing them with soap, but they won't do the step of rinsing them. So they'll wash them and then they'll dry them, but you're leaving that soap residue. So if you are using a no rinse soap, then you can skip that step, but otherwise you need to make sure you wash, rinse, then dry. This shows you how you can make a mitt with a washcloth, and this would be something good to practice at home. The use of a mitt will help you to have control over what you're doing, so it's not just this big wadded mass. It can help you like when you're cleaning the eyes, so that you have a more control over that, or when you're cleaning the perineal area. So practice using a mitt, and when you're doing your return demonstration videos, you will also want to demonstrate that you're using a mitt during those videos. This is the bathing wheel, which can be found on page 198, and it has the order in which you should bathe the different parts of the body. You start with the eyes. They're portals of entry. You want to make sure there's no cross-contamination. So you'll start from the inner aspect of the eye and move out, and then when you go to the opposite eye, you want to make sure that you're using a clean area of the washcloth so you're not cross-contaminating there. So make sure you're familiar with that bathing wheel. There are 4 different types of baths that you might possibly be giving. There's the partial bath, and this is the one that you're going to check off on or do the skill video that you're going to send to me, and that is where you're washing the face, the underarms, the hands, and the perineal area. So this is a partial bath. A shower is when somebody is able to sit like in a shower chair and you can just put them in there and scrub them up. You will do a shower video demonstration for me. So we'll talk about that a little bit later. This is an example of what a shower chair might look like. Tub bath would be another type of bath that you might give depending on the facility that you work in. It's best suited for those that can get in and out of the tub. Sometimes the tub, the side of it opens up and they can step in. Sometimes they're lifted in with a Hoyer lift. A complete bed bath is when a person cannot get out of bed, and this is where you're washing everything head to toe. Oftentimes when you give a partial or a complete bed bath, you are going to also change their bed, do an occupied bed at that time. Remember that safety is one of the highest priorities when bathing a resident. So what are some safety issues that we might come across when we're bathing a resident? Well, you can think about burns. There's, the water temperature shouldn't be higher than 105 degrees. We think about falls. Falls are a safety risk in our elderly patients in a nursing home or a long-term care setting. So they always need to have non-skid footwear on when we're involved with bathing. We think about falls like out of the bed. If you have the bed up to a good working height and you turn your back and go get water from the sink, they may roll out of the bed and fall. So we got to think about those things too. So think about safety when it comes to bathing. Infection control is another issue that we need to think about. So we're always cleaning from cleanest to dirtiest, and we want to make sure we're not cross-contaminating. When you give a bath, start on the side farthest away from you. So if I'm standing on your right side, I'm going to clean the left side first, and then I will clean the right side. So I'm going to clean your left eye and your left side of your face, and then I'll come over and clean the right eye and the right side of your face, because that way I'm not leaning over you. I'm going to clean the left hand, the left arm, underarm, wash, rinse, dry. Okay, then I'll do the right because that's the side closest to me, so I'm not leaning over your body, the area that I just cleaned. When do you change the bath water? Remember that a basin should be considered a no soap zone. So you change the water when it becomes cold or soapy, after you wash the feet and after the back. Some people like to put soap directly in the water. If you do that, you need to have a basin that is just plain water meant for rinsing. Back rubs are one of my favorite parts about nursing. I think back rubs are a lost art. A lot of people don't take the time to do it, but it helps the patient so much, especially if they're tired and their back hurts and they've been in the bed for a long time. So you want to take the time, if you can, to help them to become more comfortable and to help them to relax their tired muscles. When you're giving a back rub, this will help to give you a chance to observe their skin, and it also improves circulation. You're going to have them lay on their side in a lateral position. You're going to warm up some lotion. You can do that between your two hands, and then you can put the lotion on their skin, not directly on their skin, but on your hands, and then you're going to start at their lower back, like above their coccyx. You're going to run your hands up toward their shoulder blades and then around and down. And you can see a picture of this in your textbook to see the proper method for giving a back rub. Perineal care, you're going to want to study this in your textbook. You will be demonstrating the skills, and I'll give you some tips on how best to do this in your skill video. But there's perineal care for a female and for the male. And some factors that you're going to want to remember is to use single strokes. You're always going to wash from front to back. So we don't want to go back to front because that can bring E. coli into the urinary tract. And you're going to use a clean area of the washcloth or a clean washcloth for each stroke. And this will prevent any cross-contamination. So however you want to demonstrate that, you can use the mitt and show me different areas of the cloth for each stroke that you're doing, or you can get several different washcloths and use a clean washcloth for each stroke, however works best for you. When you're bathing, it's really important to watch for any kind of drainage or foul odors from any body area. You want to look for any changes in their skin. Also look and see if there's any pale or white, blue tinged red and purple areas on the skin. Those can be the beginnings of a pressure ulcer, which we'll talk about more next week when we talk about the integumentary system. Also, bathing is a great time to see, can they follow directions? If you ask them to lift up their arm or do something like that, what's their emotional state like? What's their level of mobility? Are they having any complaints of pain or discomfort? So use this time wisely to observe these areas. So after we get them all cleaned up, we're going to have to dress them. And dressing a resident is another skill that you'll be doing a video for me on for evaluation. When dressing the resident, you always want to begin with the weaker side of the body. So there's an acronym that we like to use called POW-TOSS. And so POW meaning put on weak, and TOSS is take off strong. So when you're dressing them, POW, put on weak, you're going to start with the weak side of the body. When you're undressing them, then it's TOSS, take off strong. So you're going to take off the strong side first. When you're talking about weaker side of the body or whatever, you don't want to call it bad, but call it weak or affected or involved. All right, so warm and cold applications. We're going to, I think, go over this a little bit more next week, but let me just hit it quickly. Warm and cold applications, you can find some information in your book on 337 to 341. And here's some examples. Cold applications, cold constricts, so it causes the blood vessels to get smaller. And warm applications, they cause the blood vessels to get bigger or dilate. So they bring more blood flow to the area, which would help to bring nutrients for healing. Where cold application constricts it, makes it smaller, which reduces blood flow to the area. So that would maybe reduce swelling, like if you think about an injury or something. So once again, heat is good for relieving pain or muscular tension, and it brings more oxygen and nutrients like I talked about. Cold can help stop bleeding, prevent swelling, reduce pain, and also bring down high temperatures. Another important factor to remember is that moist and dry applications. Moist is where there's water in contact with the body, and dry is where there is no water in contact. Moisture strengthens the effect of heat and cold, so it makes it a stronger application. You really need to watch for excessive redness, pain, or blisters when you are applying those. The other factor that's really important to know about warm and cold applications is that they should not be on longer than 20 minutes. 20 is the max. You should be checking them every 5 minutes for any redness or damage to the skin. And once it goes beyond that 20 minutes, then they can have what's called a rebound effect. So if you're trying to constrict the blood vessels by using a cold application and you leave it on past 20 minutes, after 20 minutes it can have the opposite effect and it can actually dilate the vessels. So 20 minutes is the max there. A sitz bath, I think I may have put a video about a sitz bath, I'm not sure, but it's a warm soak to the perineal area that helps to clean perineal wounds and reduce inflammation and pain. So this is obviously it's a moist application. It's a warm, moist application. It can be very helpful. One of the things to think about with a sitz bath is it can make the person feel weak, faint, or dizzy. And so it pulls all that circulation to the pelvic area. So it dilates the blood vessels down there to promote healing. And because of that, they can feel dizzy. So we have to be watching them and make sure we keep them safe if we're giving them a sitz bath. Here's just an example of a warm or cold moist application. There's an example of an ice bag, which there'll be some moisture with that, so that'd be a cold moist application. Elastic wraps can be used as kind of like an ace bandage. They can be used to keep dressing in place. They can use to help support splints or keep splints in place, or provide support to a body, like you think about a hurt ankle, and they can provide support to that area. And then just the last thing is, if you do apply an elastic bandage or elastic wrap, which you can see information about that on page 382, make sure you apply it in the direction of venous blood flow, and that you check circulation, so color, sensation, pain, swelling, things of that nature when you're applying that wrap. Okay?